Okay, so this will be our this is introduction and understanding sympatholytic drugs. It's actually understanding, right? Introduction and understanding sympatholytic drugs. So sympatholytic drugs is just basically any drugs that is like anti-adrenergic, like it's against what the action of the maybe the adrenergic receptors and all of that. So they are actually medications that inhibit the effects of the sympathetic nervous system. They inhibit the effect of the sympathetic nervous system. So the sympathetic nervous system generally is known for what? Fight or flight response, which includes like there's increase in your heart rate, there's constriction of blood vessels, there's dilating airways. Okay, so sympatholytic drugs on the other side, they block all those actions, so thereby they now lead towards like they inhibit the sympathetic nervous system, so they bring the effects of the parasympathetic nervous system in summary. Okay, so for the classes of sympatholytic drugs, you have things like what alpha-adrenergic. Those ones, they block the alpha neurons, okay, or block the alpha receptors, like Prazosin, Prazosin, Prazosin. We have the beta-adrenergic antagonists. Alright, so those ones, they block the beta receptors, like propranolol, atenolol, metoprolol. Then we have the alpha and the beta-adrenergic. Those ones, they block the two. We have drugs like what? Labetalol, carvedilol. Then we have the central alpha 2 agonist, like clonidine, metaldopa. Right, so central, it is central, talking about the brain. Talking about the brain. So mechanism of action, they usually excite their actions by what? Interfering with the normal function of the sympathetic nervous system. So when they block the adrenergic receptors or they reduce the release of neurotransmitters, the drugs usually help to what? Decrease heart rate, dilate the blood vessels, and lower pressure. So they are now used to now treat all those conditions of the heart that basically increasing heart rate or constricting vessels. You understand? These drugs will now counter them. So they are used in treating things like hypertension, angina, heart failure, arrhythmias, benign prostatic hyperplasia, and all of that. Okay, so they have some one or two side effects, like on general, like dizziness and lightheadedness, fatigue, bradycardia, postural hypotension. Then they can also now want to cause you to actually sleep. You get? So I think basically this is just it for the introduction, where we are picking each of those types, each of these classes. We'll pick them, then talk about them again.